years, the most predominant assessment we use is heart rate variability. And what heart rate variability gives us is an opportunity to look at how the autonomic nervous system, or the sympathetic and parasympathetic nervous system, controls and coordinates the cardiac rate and rhythm. And this is a direct measurement of high frequency, low frequency, and very low frequency waveforms from the brain via the vagus nerve and the autonomic nervous system to control our heart rate and rhythm. The other thing that we use to monitor is a fairly new medical device called ES-Tech, and this uses bioimpedance through the body, which is electrical conductance measured in AC and DC over 22 different pathways, as well as plasmography, which is oxygen carbon dioxide, pulse ox ratios, and heart rate variability. And from this device, we're able to determine quite a number of things. In the cardiovascular system, we are able, of course, to determine heart rate and rhythm, and the same parameters that we do with our other heart rate variability. In addition, however, we are able to calculate the systemic vascular resistance, which is the total amount of resistance to the flow of blood through the body, the ejection fraction of the heart, the blood volume through the heart from the lungs, the tension or tone of the peripheral vascular system, or the small arteries and veins, and quite a number of other parameters. We also, as a part of the bioimpedance examination, get to look at body composition. And body composition isn't just how much lean and how much fat you have, etc. But one of the biggest components that we're able to measure is intercellular and extracellular water. And this will be important. I'm laying a little foundation for you in our physiological measurement, because I want to discuss and speak to you about the influence of Teratol in human physiology, just as you've heard about it in agriculture and animal biology. The importance of intercellular, extracellular water exchange is that if there's too much water inside the cells, they get swollen, they get lethargic, they don't operate the way they should, and there is a loss of energy because of the diminishment of what we call the ATP cycle, or the cell energy cycle. The mitochondria actually are compromised by excess fluid inside the cells. Conversely, if the cells are dehydrated and can't absorb water into them, and there's a lot of extracellular fluid, which many people would view as swelling or edema, such as in the ankles or so forth, people with congestive heart failure or other types of issues, where they have a lot of water outside the cell, and their cells are dehydrated at a cellular level, and yet the usual treatment for that is to do a diuretic, which compounds the problem by trying to address the symptom, not the cause. So, having said that, how did we get involved with Teratol? Well, as I said, I've done biological and energetic medicine for over 26 years now. And one of my colleagues, Dr. Dan Clark, holds a conference every year, the Bioenergetic Medicine Congress. And I almost always attend if I can, but I've lectured at about 8 of the 13 of them that he's held over the last 13 years. And this year we were in St. Petersburg, Florida. And so I was invited to speak about it was all about cancer, and so I was invited to speak about monitoring physiology through, during any type of cancer treatment, and to show how we monitor people's physiology. While we were there, it was an interesting Congress because Dr. Clark invites people to attend as vendors. And unlike most congresses where you can be wide open, and anybody who can pony up to buy a booth can come, this conference had only invited vendors. And so it was a small vendor venue. There weren't, maybe 20, 22, 25 different people there with different equipment and products and so forth. And, that's where I always go because I want to see what's new, what's happening, meet people, talk to people I haven't seen for a while, and so forth. And I ran into Texas with some dirt called Teratol. And actually, when I ran into him, I was sitting there taking a break and having a nice tea and watching the Gulf of Mexico. And I heard these fellows talking about this stuff, and being interested and brought forward, I just kind of asked if I might join the conversation and find out about what Teratol was about. It turned out I wound up spending most of the weekend on my free time with and his colleagues there, and learning the ins and outs of Teratol. And I came home and I got a bunch of it, and started taking it myself and measuring my own physiology. And then I started to test it against my patients. I do electroacupuncture as a testing procedure. And boy, it seemed like this Teratol product resonated to an awful lot of people. And so we started to employ it in our clinical practices. Well, I was... the outcomes that we saw, because frankly, I have literally hundreds of homeopathic herbal tinctures, nutritional, high-level nutrition available in my dispensary here. And over the time that I've been doing this type of work, and all this other sort of thing. Well, Teratol, it turns out, is an extremely effective, safe, and well-tolerated base or foundational nutrient for human physiology. The first thing that I noticed repeatedly was irregardless whether the cells were bloated with water or whether they were dehydrated and there was a lot of extracellular water, within a week to 2 weeks of beginning on a regimen of Teratol, just at one a day, people's intercellular, extracellular water was balancing very significantly. If they had a lot of edema, they would diurese. They would urinate off the excess fluid. People that didn't sweat started sweating again, because our skin is our third kidney, and not sweating is not a good thing. Now, I know quite a few of you are from the Dallas-Fort Worth and from the Texas area, and you'll be sweating plenty soon. So if you don't sweat in Dallas in the summer, you better go see the doctor, if you know what I mean, because it gets hot and humid down there. Anyway. We began to see a lot of other beneficial effects from the use of Teratol. And I started to give it to almost every patient that came in as a foundational nutrient, instead of trying to pick, oh, you need this mineral, you need more magnesium, or you need more calcium, or you need more vitamin D, or etc. It seems that the major influence of the Teratol is on ionic exchange within the cellular muscular tissue. The longer someone was on it, the more we began to see effects.
It's like a line about right here where the Wi-Fi
of oxygen. And then an even more can you hear me?
You might tell him turn.
And then an even more significant measurement, which is what we call VO2, or the delivery of oxygen. Now, carrying oxygen around is one thing, but delivering it at the cellular level and exchanging it out for carbon dioxide is another. And we began to see very, very beneficial shifts in oxygen carbon dioxide metabolism. And so these are two of the major factors in maintaining normal and strong human physiology. Let's think about it. The compensation reaction in a human body, in any mammal, is if you have an excess of chloride ions in the tissues or in the extracellular space, it will bind to an HO or a hydroxide and make hypochlorous acid. And this acid needs to be buffered. And so the body will have to pull from what we call the serum bicarbonate excess to buffer the acids produced by excessive chloride ions. And this makes for what we call tissue acidosis. Well, the body's compensation of that is to respirate more and to increase tissue oxygen. Now, when that goes on unabated for too long, the oxygen delivery system begins to get compromised. And when the oxygen drops, now you have acidic, hypoxic tissue. A perfect breeding ground for microbes and other diseases, especially degenerative diseases, where the tissues have to go into anaerobic metabolism and they begin to form abnormal tissue, or what is often known as cancers. And so, by maintaining a normal state of affairs between the ions of the intercellular and extracellular space, as well as a robust oxygen uptake and delivery system, it minimizes the physiological stress on the body that precipitates and precedes disease. One of the things we talked about while we were down there at the conference was animal husbandry. And I'm a country boy. I live out in the country here in Pennsylvania. And I raise Morgan horses. I have about 8 of them. And we have a little bit of a funny farm, Jack Russells and chickens and you name it. And so I started to put Theratol into my horses. The first thing I noticed is my aged horses, I have a couple that have been around and carried me a couple 100,000 miles over the hills up here. So instead of sending them down the road, we keep them in their pasture ornaments and 1,000-pound pets, and they still get ridden by the kids and so forth, but they're kind of semi-retired, and we ride younger stock. But first thing I noticed is it looked like somebody was out brushing my horses all the time, because their coats started shining up a lot better, even coming into winter. I noticed a difference in the hoof consistency and pliability and strength. I noticed a difference in their feed consumption, and most of your country people will notice a difference in their manuring and how it cleared them out. So we use it all the time in all the critters at our place, including all the humans. My wife, myself, my son, fiance, and so forth. And so we have just been really enamored with Theratol.